Thanks, Kevin. It may not be a topic people want to discuss, but the cases of gonorrhea, a sexually transmitted disease, have been increasing in New Hampshire. People with gonorrhea often don't have any symptoms, yet it can cause permanent damage, especially in women. Gonorrhea is treatable through prescription medication, however, so it is important to contact your healthcare provider if you think you may have been exposed to this or any other STD. Here to tell us about what we need to know about this infection is New Hampshire State epidemiologist Dr. Benjamin Chan. Thanks for joining us, Dr. Chan.
My pleasure, thank you.
What should people be looking for in terms of symptoms for gonorrhea?
Yeah, so as you mentioned, gonorrhea is a sexually transmitted disease. It's a bacterial infection. It can be transmitted through multiple different types of sexual contact. But as you mentioned, many people will not have symptoms, but they can still be infected and they can still spread the infection to other people. For individuals that do have symptoms, oftentimes the symptoms can be mild. They can include burning or pain with urination, penile or vaginal discharge, to name a few. But if it's untreated, the gonorrhea infection can go on to have serious health consequences. So the bacteria can spread into the bloodstream. It can cause a life-threatening bloodstream infection. In women, the bacteria can move up into the uterus and fallopian tubes and cause infection, a serious infection of the reproductive tract called pelvic inflammatory disease, or PID, which can impact future fertility and pregnancies. The good news is that it is a bacteria. There are antibiotics to treat it. Usually it requires a couple different types of antibiotics to treat.
The Department of Health and Human Services just put out a press release on this today. How
Correct.
much have we seen gonorrhea increase here in the Granite State lately?
And so we're calling this an outbreak, and this is an outbreak that's been developing over the last year or so. An outbreak just means that we're seeing a significant increase in the number of cases above what we normally see. So to give you an idea, between 2007 and 2013, we saw on average about 130 cases of gonorrhea reported to the New Hampshire Health Department every year. In 2016, we've had 465 cases reported. Now that's a 2.5 times increase above what we normally see. It's not entirely clear what the cause of this is. We're still investigating, but it doesn't appear to be confined to any single, patient population or a group of individuals.
Nonetheless, who should seek out testing?
Yeah, so because gonorrhea is sexually transmitted, anybody that is sexually active should be talking to their healthcare provider, especially those who are at higher risk of STDs. This includes people that have multiple sex partners, people who have unprotected sex. They should talk to their doctors about being tested. Certainly anybody that's symptomatic or having symptoms should talk to their doctor about being tested. And one of the things that we're trying to do is connect sex partners, so partners that have had sexual contact with somebody diagnosed with gonorrhea, try and get them connected to healthcare. Now, certainly access may be an issue, and we recognize that there might be some financial limitations. And so on our New Hampshire Department of Health website, we have published a list of clinic names, STD clinics where people can go for low or no cost. They have to set up an appointment, but they can be tested and treated for STDs.
All right, a difficult subject to discuss, but one
Yes.
that is important nonetheless.
Very important, yes.
Dr. Chan, thank you for your time. And